RP data. This is a Bloomberg article. This isn't from the Republican Policy Committee. So the point is, who gains? Who gains from this legislation? Who's going to make hundreds of millions of dollars more because they provide the Medigap policies that people will be deprived of when we kill off Medicare Advantage? AARP.
Mr. President, I see that the senator from Texas and the senator from Idaho, the senator from Wyoming have all come to the floor in addition to the sponsor of the amendment, Senator Hatch, and I'm sure they are prepared to reflect on who's hurt by these cuts. The only thing I would emphasize with what you have said is that disproportionately low-income Americans in Texas and in Idaho and in Tennessee and in Wyoming and in Utah are hurt. Only a third of eligible white seniors who don't have Medicaid or employer-based insurance are enrolled in Medicare Advantage, but the number increases to 40% for African Americans and 53% for Hispanics.
Could I ask the senator again? He described the benefits that are provided under the Medicare Advantage program that seniors can have if they want, right? Are those same ability, dental, vision, hearing, and fitness care, is that available under regular Medicare today?
My understanding is the answer is no to that.
No.
The reason 11 million Americans choose Medicare Advantage is because these benefits are not available under the original Medicare plan.
And in Montana, there are 27,000 enrollees who will see a 24% decrease. In Connecticut, there's 94,000 enrollees who will see a 14% decrease. And by the way, some special deals have been cut for 3 states, I understand: Oregon, New York, and Florida. We're going to try to fix that. Or there's no reason why one state should be shielded any more than another from these draconian measures. We're going to try to fix that. But the reason why I bring up this issue, present-day Medicare beneficiaries don't have vision. They don't have dental care. They don't have fitness. Yet we here in the United States Senate enjoy it every single day. So yesterday what we did was we voted to deprive seniors from the ability to have the same privileges that we enjoy every single day in the United States Senate. I would argue that's an exercise in hypocrisy.
Mr. President.
Well, I might say we're operating under a colloquy managed by Senator Mccain, and so the Republican senators are free to engage in a discussion.
Senator Hudson, just speak.
Well, I very much appreciate what the senators have been talking about, because what you're saying, Senator McCain, is that these seniors who are low income have an affordable option, and it's less expensive than the AARP option that would give them this extra care. The eye care, the dental care, the hearing aids. It's an affordable extra option. In Texas, we have over 500,000 seniors enrolled in Medicare Advantage, and one of the great things about Medicare Advantage is that it is available in rural areas, and it gives them choices that they might be able to afford with other programs that are Medigap. This one is affordable, and that's why we're fighting so hard to restore the cuts to Medicare Advantage. Medicare Advantage costs about 14% more than traditional Medicare because it provides a wide range of these extra benefits that we have discussed: dental, eye care, hearing aids, and in many cases, it pays providers more. Republicans, of course, are open to discussing how to improve the Medicare Advantage payment formula. We want to be more efficient with taxpayer dollars, but do we want to do that in the context of creating a massive new entitlement program and ask Medicare to pay for it? Or to cut life-saving benefits for seniors? Is that what we want to do? Senator Crapo, I mean...
Thank you, Mr. President. No, that's absolutely the case. And I'd just like to point out, when we had the Finance Committee markup, I asked CBO Director Elmendorf directly whether the provisions in the bill, which are still in the bill, would reduce the benefits that Medicare recipients receive. And his response was, for those who would be enrolled otherwise under the current law, yes. I mean, there's been a lot of talk here about, well, we're not cutting Medicare benefits, or we are, or it's this or that. The bottom line is the CBO director said it directly. Yes, we're cutting benefits. And I'd like to ask the sponsor of this amendment a question, because I know there are some who are saying, well, the reason we're cutting Medicare Advantage is that it's so expensive, and we should be cutting Medicare and controlling its costs, and that it's like 14% more expensive than fee-for-service Medicare. Some people say, well, if you're defending Medicare Advantage, you're defending overpayments in health care plans. Would the senator from Utah like to respond to that criticism that some are making?
Well, I'd be delighted to do that. You know, to be clear, the so-called overpayments to Medicare Advantage plans do not go to the plans. As a matter of fact, they go to the seniors in the form of extra benefits. That's a pretty important thing that a lot of people miss. 75% of the additional payments to Medicare Advantage plans are used to provide seniors with extra benefits, including chronic care management. You would think you'd want to do that. Hearing aids, eyeglasses. The other 25% of any extra payments are returned to the federal government. I mean, I can't imagine why anybody wouldn't want to do that.
Mr. President, I would ask the distinguished senator from Utah, let me ask you to also respond to the arguments that claim that the government really can't afford now to continue overpaying these private plans, and that the Medicare Trust Fund is going broke. Of course, we tried actually several years ago to shore up the Medicare program, trying to do it in a responsible way, not cutting out the Medicare benefits that these seniors can receive as an affordable option. But what do you say to that?
Well, you've pointed out the Medicare Trust Fund is going broke, and yet what do we have from the other side? Take almost $500 billion out of Medicare. Now, to trust me, I'm deeply concerned about the solvency of the Medicare Trust Fund.
Could I say, it's my understanding that Dr. Barrasso has actually seen Medicare Advantage patients. He and Dr. Coburn are probably the only two, and maybe we could give us the benefit of his experience, and also not only the benefit of his experience, but I'm sure he's going to tell us what's the impact going to be on these people, on the low-income seniors from his state.
Well, I agree with the senator from Arizona that people choose to be on Medicare Advantage. 11 million people have chosen to be on Medicare Advantage because it's a wise choice to make, because they get better benefits. They get dental care. They get the vision care. They get the hearing. They get the fitness thing. But
we do.
Just as we do. And, and it works on preventive care and coordinated care. So it's no surprise.
I don't think they have as nice a gymnasium, though, as we're going to get.
It is also no surprise that when people read about this and learn about it, that they would want to be on Medicare Advantage. Because what the senator from Utah has said, and the sponsor of this amendment, is that the money that goes into this program is for the benefit of the seniors. It's for services for the seniors on Medicare. And I mean, to me, this whole bill basically guts Medicare, raids Medicare to start a whole new program. And in today's, since the senator from Arizona has mentioned in these articles, today, Associated Press and USA Today, Senate Democrats closed ranks Thursday behind $460 billion in politically risky Medicare cuts at the heart of health care legislation. Goes on to say approval would have stripped out money to pay for expanding coverage to tens of millions of uninsured Americans. So they're going to take $460 billion, this says, away from our seniors who depend upon it for their Medicare and start a whole new government program. It says, Washington Times, front page story, headline, Democrats win cuts of $400 billion to Medicare. Mccain pushed for another way to pay. So I look at this and say, this is not fair to our seniors, not fair to the patients that I have taken care of for 25 years in Wyoming, taking care of families, taking care of folks when they, grandmom breaks her hip, and what we need to do for our patients. So these are choices that people have made. 11 million Americans have chosen Medicare Advantage because there is an advantage to them for the health care they get, the additional services, the coordinated care, the preventive care. Anyone who looks at this and studies it says, I want to sign up for this. And it's been wonderful in rural areas. It's been wonderful in big cities. This has helped a lot of people in the country. So it's not surprising that 1 out of 4 people in the country on Medicare have chosen Medicare Advantage. But yet what we're seeing here is the Democrats want to get rid of Medicare Advantage. So
let me get this straight. So basically, by removing the choices that seniors have as a part of Medicare Advantage, dental, vision, hearing, fitness, etc., we are taking away from them